Yeah.
Hello, good afternoon. Here we are once again on the Higher Self Expo Facebook and YouTube page to present one of the speakers that will be with us during the Higher Self Expo that will be taking place on the 17th and 18th July under the theme Where Science Meets Spirituality. This Higher Self Expo is the 4th edition, and it will be very special and different because this time it will be going on 24 hours straight, starting in the United States timetable, then going on to Australia, and then coming on to Europe. So my name is Tanya Castillo. I will be presenting and hosting in Europe together with Lijfwacht, and it is a pleasure, Dr. Léon Scheepers, to have you here today. Thank you very much. Could you please let us know a little bit more about you?
Yeah. So I'm a graduated medical doctor in 1980 at the Leuven Catholic University. It was after 7 years study, but I interrupted my study after 3 years. After my candidature, I did travel around in South America during 1 year. And I was working there in a psychiatric hospital and in a hospital for the poor people. And I was traveling around a little bit. Then I came back to Leuven. I finished my study. And after I was graduated, I did follow a course of 6 months at the Tropical Institute in Antwerp. Then I was one of the first medical doctors going abroad with medical doctors without frontiers.
Yeah.
So yeah, so Médecins Sans Frontières, and I did spend 6 months in Thailand at the Cambodian border with Cambodian refugees, because of the regime of Pol Pot at that moment. And then I came back to Belgium, and I did replace some colleagues, and I got information there about education that started for the first time, and it was about homeopathic medicine. And when I read about it, it was really for me an eye-opener. So I always like to study medicines, but I was always a little bit frustrated about the way people were treated, and the way people were the way people were treated in general. And in this education, yes, I felt from the beginning that this was my way, and so I finished this study after 3 years, and then started at the same time I started a private clinic, and well, so it went on. So I became teacher, and I founded my own clinic, etc., etc. So we are working with 12 therapists in my clinic, and we are 4 medical doctors, and we have 9 therapists. It's going from acupuncture to osteopathy to psychologists, yoga. We are offering yoga, etc.
So it's been 40 years of practice, and you look so happy. That must be because you're doing something that makes sense to you. Then when you managed to join regular allopathic medicine with homeopathic, then it sort of became something that satisfies you very much. It looks like it. You look like a really happy person.
No, that's yeah, you are right, and it's it's a passion, to use the word of your conference, but it is a passion. because in nature, all the substances are present to help people. And these substances are from the how do you call it? Rorium, the plant rorium, the plant kingdom. The plant kingdom are made from minerals or from animals, and even disease products of diseases we are using. For example, we are using carcinosinum, and carcinosinum is made from cancer cells of the women suffering from breast cancer. So yes, it's amazing. It's amazing to observe almost every day what products just present in nature all over the world can provoke in human beings and can help human beings to cure, when it's necessary, an acute ailment like an acute bronchitis or acute otitis or acute flu, or it can also support people in their way of life with all the difficulties we may.
Sorry. So
No,
in this conference, theme is where science meets spirituality.
yeah.
So what will you be presenting within this theme that ties these worlds together?
Yeah. So
During the conference.
yes, I should like to explain what is the bridge in between the homeopathic science, between the homeopathic art and spirituality, because we are using everyday spiritual features of the patient's spiritual symptoms. For us, the most important are the mind symptoms, and it doesn't matter which ailment the patient is suffering from. We are very interested in what's going on in this patient, what in his mind, what did happen during his life, and not only during his life, but also during the life of his ancestors, about the life of his grandfathers, his parents, his grandparents, and that where there is a link between how we are thinking and how we are working, between epigenetics, that's a booming part of modern science since 15 years, and the miasmatic theory we are using in homeopathy. And I should like to explain this link. So, because this is very important in modern science, epigenetics becomes more and more important. And this is the kind of thinking we use already 200 years in our homeopathic approach. So in that way, I shall explain how to make the bridge between science and homeopathy and spirituality, but homeopathy is spirituality.
Yes, it is the spiritual approach of medicine, basically.
Yeah, and of people.
Yeah, exactly. As the person as a whole, in the holistic form, as a whole human being with mind, body, and soul.
Exactly. And
okay.
so applicated also in children, because children, the behavior of children is very always very pure. A child is coping. We, as an adult person, the most of us are coping. When we have a problem, we have the tendency not to let show it directly. When a child is angry, then you will see it when the child is angry. When the child is shy, you will see that the child is very shy. So also in children, we can use all these symptoms.
And so you, having been working in medicine for 40 years and basically having started almost at the beginning of your practice to introduce homeopathy, you have been a pioneer. in this
not, yeah,
in terms of joining both worlds of being a medical doctor
yeah,
who also uses
yeah,
homeopathy and makes the bridge in
yeah,
that respect.
exactly, and that is very important. I think it's not a good thing to think in extremes. We need the allopathic medicine. We
Both.
need conventional medicine. We need both. I'm practicing conventional medicine every day, and when necessary, I will prescribe antibiotics. But I will only prescribe it really when necessary. So this makes that even in an average practice of a general practitioner I have, I'm only prescribing maybe 20 times a year antibiotics. So
Wow.
yeah,
And you have a lot of patients, as
yeah,
far as I've realized.
yeah, we have patients with bronchitis, with otitis, with tonsillitis, all these problems. So it makes a difference, but we are not criticizing the conventional medicine. The only the in fact, the message I want to give is, when it concerns medicine, that the way we are working should be the standard. It means, in the first place, you try to help the patient with, in my case, with homeopathy. And when you do not succeed with homeopathy, then you use the conventional medicine. So now, in general, it's first conventional medicine.
It's the other way around.
The other way around, and people are not feeling helped by conventional medicine. They visit us, and then we have to resolve problems
that are worse than they were at the beginning.
Yeah, you understand.
Yeah.
So
yeah,
that's let us say a mission, and that's
they
all.
want you to be the miracle maker.
Yes, at that moment. But that's what was just talking about is also the mission of my book I wrote. My book Bodyguard. It will be published in English the beginning of July. I will one of the coming weeks I will make already a site in English, and I can explain a little bit more about my book and about my insights.
So you'll also do that during the Higher Self Expo presentation.
Yeah.
Just one last thing. So if people want to work with you, if people want to have medical consultation with you, do they also have the opportunity of working with you like online sessions, or only in presence in your office?
Because of the COVID pandemic now in Belgium, all medical doctors are working more and more with sessions online. So yes, it should be possible, but the live consultation stays the best way.
Of course.
To feel the patient, to really, yeah, we have to observe the patient. But it's possible.
It's possible. Okay, so people can go to your website and see what you're doing and book consultation for your office if they live in Belgium, or eventually also in other places get in touch with you.
They always can contact me. Yes.
Great.
I'm retired, but I'm still working and still very active. So no.
It must be a real pleasure to have a doctor like you, because you are so passionate about what you're doing.
Yeah. It's only yeah.
I'll show a few comments here from some other of the speakers that will be with us that are watching this live session with you. So we've got Jennifer Baraku. She was in pharmacy and is now a psychologist. And she says nature is the best pharmacy.
Yeah.
Then we have Louisa Tanner Munson, who's also going to be with us during the Higher Self Expo. She's an astrologer.
Yeah.
And Thank you, Louisa. Thank you for the compliment.
Thank you.
So she says, carcinosinum, which is what you were talking about, is a remedy I've taken, very powerful, very useful. And then still here, a bigger comment, was a remedy to help cure maternal line that I'm on. It was very useful for clearing the need to be perfect. I'm hoping I don't pass this on to my children. It's the initiation of shame. Thanks for this amazing chat. Looking forward to listening to the whole presentation when you present during the Higher Self Expo. And still, Jennifer, people often have really high expectations to a doctor and are disappointed when not getting a prescription. Oh, yes, that's so very true.
Sure. No, it's very interesting. Thank you very much for your comments. And so I will talk about this topic, about the miasmatic theory and about what we call the nosodes. And they are really acting very deeply. They are acting in the ancestral energy of a person. So it's completely right what some of the comments was saying about I had to, my maternal shit, or I don't know.
The instinct of perfection, being perfect, having to be perfect.
Exactly. If maybe when you get more comments, maybe you can let me know, and then I can really. I have 45 minutes or 30 minutes or how long?
45 minutes during the conference. Yes.
Yeah, the conference. So then I can really talk about this, because
certain issues.
Yeah, and then we go to spirituality. Then it meets. And homeopathy is science, because homeopathy is curing like with like, or with almost like. And this is a law of nature. And this law will never change. It's a law since humankind is existing. So and this is also science. So I will talk about it.
Wow, that will be wonderful. I'm looking forward to listening to your full presentation. Jennifer says here she loves the title, Bodyguard, and looks forward to your speech. Also, she's very much into medicine as well, having been in pharmacy and now in also another way. And I suppose that will be all for today. And it's a very good teaser for us to want to know more. Thank you very much for being with us, Dr. Léon.
You're welcome.
Thank you. See you soon in July. On the 18th of July will be Dr. Léon's speech, because he's in the European broadcast. So we're on 17th and 18th, and yours is on that day. Thank you very much, everyone. Thank you for being with us today, and see you all soon. Thank you.
Bye-bye. Bye.